I'm Abby Armstrong, and this case presentation is a unique type of birth trauma mistaken for abuse. So a 2-week-old female infant was born at 33 weeks via C-section. Parents brought the infant to the emergency room after noticing, in their words, she wasn't acting right. After examination, it revealed that the infant was minimally responsive, hypoglycemic, hypothermic, had mottling of the skin, which means there's a bluish-red lace-like pattern under the skin, and poor muscle tone. She was transferred to the PICU and given albumin and normal saline, which helped improve the skin mottling. Bilateral bruising in the outline of fingers was found on the infant's back as well as genital bruising. After doing a CT scan, it revealed bilateral soft tissue swelling at the back of the head, bilateral calvarial fractures, and possible cortical vein thrombosis. The infant continued to deteriorate and passed in just over 24 hours after being admitted to the hospital. The autopsy findings, postmortem findings showed skin slippage as well as dark purple skin discoloration, cranial vault fractures, circular bilateral defects on the left and right parietal bones, and collections of blood within the scalp and subgleal. Subarachnoid congestion was found beneath the dura, focal consolidation of the lungs, acute hemorrhage of adrenal glands, and thickening of the septal and alveolar walls in conjunction with inflammatory cells. This is a CT scan they took at the hospital, which demonstrated the bilateral calvarial fractures and possible cortical vein thrombosis. And I just want to give a quick warning that the next couple of slides are pretty graphic and display images of blood. So image A on the left is displaying the posterior view of the bilateral parietal fractures. Image B is showing the detail of the left parietal defect, and image C on the right is showing the detail of the right parietal defect. Figure 3 and 4 are showing you the collection of blood and subarachnoid hemorrhage of the infant's brain. So you can see this after the removal of the parietal bones, and then the hemorrhage after removal of the dura. In the neuropathology findings, softening and focal parenchymal hemorrhage was seen, congestion and hemorrhage within leptomeninges with purulent leptomeningitis. Organizing hemorrhage was found in the epidural region, and focal optic nerve sheath hemorrhage, although no retinal hemorrhage was found. Figure 5, you can see high magnification of a section of the frontal lobe showing purulent leptomeningitis and gram-negative bacteria on the gram stain. In the microbiology findings, the only organism found in the bacteria cultures was Enterobacter collocae. And in the anthropological findings, you can see in figure 6 that the left parietal shows 2 overlapping circular defects that measured 20 by 40 millimeters. The right parietal shows a circular defect measuring 20 by 22 millimeters, and rounded fracture margins were seen displaced outwardly with subperiosteal bone formation, which indicated healing. In the medical history, it was noted that the delivery was very difficult. The mother developed preeclampsia, so the baby was delivered by vacuum-assisted cesarean section at 33 weeks. Vacuum extraction is when a vacuum cup is suctioned to the fetal scalp to assist in delivering the baby. The father noted his wife was pulled across the table during delivery. After delivery, the infant scored 9s on her APGAR tests and appeared to be healthy, although she was losing weight because she was struggling with feedings. Because of this, multiple well baby checks were done after being discharged from the hospital for the next 2 weeks and showed improvement in weight gain. So vacuum extraction should only be attempted up to 3 times in the span of 30 minutes. In this case, there were multiple attempts of vacuum applications to the skull, which ultimately showed that the skull fractures were consistent with vacuum extraction followed by natural disease. So abusive head trauma was ruled out, although it did mimic a non-accidental injury, and the overall cause of the infant's death was due to the vacuum extraction trauma.